So we are back from the little pause, and right now we're going to have a person who by some is called the father of Latvian game development, Raimonds Ūdris, and he will talk about trauma simulator, development of virtual reality training simulator. Round of applause.
Yes, thank you. Yes, my name is Raimonds Ūdris. I am one of first creator of the trauma simulator. I am programmer. I am technical person, making UX choices, making game designers things, everything what is needs to be making this game. Yes, and for now maybe video.
Introducing Trauma Simulator, an innovative virtual reality training simulator that helps medical professionals and students train in emergency medicine. Featuring both learning and simulation modes, allowing for step-by-step assistance or real-life simulations where correct decisions are critical. Important feedback and grading is presented to trainees, highlighting areas for improvement. Multiplayer and team training allow for collaboration and training in a safe environment, from any location, with multiple patients. Trauma Simulator is a cost-effective tool that can be used anywhere or anytime without the need for expensive medical training equipment. Scenario Builder is an innovative way for teachers to easily create training scenarios that reflect real-world situations and that fit within a given curriculum. Trauma Simulator has been created in collaboration with medical professionals, featuring research from multiple medical institutions to provide the most realistic and immersive experience possible. The dynamic vital signs monitor responds to medications and other medical interventions in a realistic manner, allowing for vital feedback. Trauma Simulator has been tested to international standards by a panel of experts and is already in use by the U.S. Army with research partners in the Telemedicine and Advanced Technology Research Center, U.S. Army Medical Research and Development Command, and Yale University School of Medicine and Army Research Laboratory. Contact us for a demonstration.
Yes, thank you. We are a very small team. We are 6 people who are working together. I am, as I said, main programmer. We have a couple of 3D artists. We have medical consultants and some managers. But we started with cooperation with US Army Medical Center Medigan and with Dr. Kaylee Cooper, what you see in this picture, yes, and it is my person who is contacting with US Army, and with him we cooperate making a project and make these grants for US departments. For now, we win European Defense Industry Development Program, cooperate with Latvian Defense of Ministry, and yes, for 3 years we needs to make some extent of our scenario builder and make some improvements of trauma simulator in this program. First, before we starting about some trauma simulator, I tell about task about what our goals of trauma simulator. It is sequence of treatments. It's not treatments itself. It's not surgery simulator. It's you need make right sequence of these treatments, and then you have successfully training this program. Yes, but everything what we do, it is more or less, it is UX decision. We start this UX decision starting from headset. When we starting, it's 4 years ago. It's nothing in this headset market. No Oculus Rift, no Oculus Quest, no Vive or something else. We starting with mixed reality headset. And yes, we chose Unity because mixed reality headset have Unity SDK, and yes, we chose it. But as I said, we have every step when we make this program, we need to be some decision of UX. And first decision is this movement around environment. In this time when we start, almost all programs using this teleportation, but in our case, our room is very small, and this teleportation, it's very hard to use because you cannot point on this ground. And yes, and I make the sliding move just for self. I always sitting in my computer and just need the sliding around. But yes, the sliding is very good mode, and for now it is mine of movement method. Next thing, it is items and how to use items. In our competitors use mostly UI. Just you see UI and click on UI elements, and in that way you can choose some treatments or something else. But we don't like this, and we start making we can items pick up, items drop, items use, items. When you pick up some items, it is right position in hand, because if you make only grabbing these items, then you cannot take in virtual reality in real position. For example, scalpels needs to be right position, this scissors or something else, and then we make this animation. You just grab and you see this in right position, because doctors said yes, it is better than you have this not really wrong position. Of course, we have some classic UI, but we make this choice. It's tied to some persons or maybe some items, and if you just calling this this person, you open this menu and can send some commands or something else. Yes, we have absolutely classic UI. This is a tablet. You can take in hand this tablet and see some more information about, for example, blood analysis and something X-rays, for example, and other things. And yes, this is a very useful tool for all commands. But yes, as I said before, our goal not treatment itself, but some treatments is very important. For example, this intubation methods. and where you need use more than one instrument, and you need use this ventilation system, and then you can make this treatment. And for some this complicated procedures, we make these steps all step by step what we need. Yes, for example, some we have only grab some item, put on patient, yes, everything is done. But some complicated and very specific treatments, we use every step correct. Yes, motion sickness, this is very big problem in virtual reality by itself, and we are this too, because we using this slipping, this sliding method of movement. It is very big problem, and we have testing in RSU with students. We have see about 3 or 5% of users is in motion sickness. Not only with our programs, but maybe sometimes just put this virtual reality headset and you got this dizziness. For reduce this motion sickness, yes, we have, of course, this teleportation between some locations or far locations, and this there is one trick interesting in virtual reality. When you have you don't need look to down or up, and you need this make this attention as more as possible to straight of high level, and yes, and our patient is very low positioned. Everything need to going looking down, but to compensate this, we making, for example, these vital things very high, little bit higher, and then it's compensating. And of course, very big problems it is environment. If we're using this physics going, for example, then this environment needs to be very, very flat, very smooth. And if you make some these mountains, then it's very, very fast to go into dizzying, and you need look at this. Okay, please video. Yes, with in our program we have this helicopter, but it's just a visual object, and for me it is like a red flag for a bull. I don't like some just not moving but interesting things, and that make this helicopter fly. Music sound. Yes, and but this experiment showing be only 2 persons who can fly with these helicopters, and the other going dizzying about 10 seconds after this flying. But yes, this is interesting thing. For now, I make some guns for this helicopter. Yes, I like just making games. Yes, our trauma simulator mine this person, it is patient. Yes, we have very much very many this body parts, clothes, injuries, points, anything what we need for this patient looking as much as possible for real. And yes, we are trying this program to the RSU. It is medical students. It's okay, but when we when for us come some some people and see this in virtual reality, then it's not so good view for this bloodness and everything, yes. And that look like our patient treatments points, as you see. There is everything with colliders, and any collider is for some treatments. Yes, we have animation, shaders, and everything for these patients. Yes, we have many instruments, medical beds, fully functionally, for example, these vital signs with sound effects, with this all these graphic lines. And yes, when real life doctor make this treatment, it's not alone. It's always have assistance, and we have this medical staff who can help our patient, not the patient, but the player for this treatment. And we have voice listener for this medical staff. You can tell some commands before you see this individual menu, and you can make this in tablet too. Physiology Engine. Physiology Engine, it is very needed for our trauma simulator. It is mine heart of this trauma simulator. This is calculation of all vital signs with these patients. You can give this physiology engine biologic some data, gender, age, something else, define injuries, vital thing, and you can see these vital things: heart rate, birth rate, blood analysis, and so on. For now, we're using two engines, pulse and biogears, but we made our own trauma simulator engine. It is for a little bit simpler injuries, yes, because this pulse and biogears, it is very performance hard for trauma simulator. Yes, mine system, it is grading system for evaluation. This player, yes, but there is this is very hard system, because many doctors, one doctor thinking, yes, you need first place tourniquet, then bandage. Next doctor thinking you need place bandage, then tourniquet. It's not a mathematical formula where is all clear, but here is all individual things about it. And we have, I think, 5 or 6 times we rewrite this system, and I think we rewriting it again one more. So multiplayer, it's very important. Our clients very needed for multiplayer. First of all, we need, for example, some mentor in this room, and it see what happens, what the player do, what treatments it do. It's right or wrong. It can help with sometimes. And of course, we have, for example, this mass casualty scenario when you have multiple patients, injured multiple patients, then you need some command in this multiplayer, yes. And one thing you see this scheme about cloud, this is because we have one client who needs 20 players, 20 patients, we have problems with 2 patients with our performance, but if we have 20 patients, it's just this program stop working. And yes, then we making this cloud system where is all this medical information calculated on server, going to the some stream machine, and from streaming, with the streaming you can send to headsets. And we make this experiment in ADG polygon with LMT, LVRTC and NVIDIA. Yes, it's this system, it's working, it's very nice. Okay. Yes, PC version. Of course, when we starting, we don't thinking about PC version. We just making VR version, and this is real problem after a year or maybe 2 years. We need to be this PC version. First, we need because decrease this motion sickness, not decrease, but because some students cannot playing this simulator in virtual realities, and we need this PC version. Second thing, it is when because we are this trauma simulator for army not going everything in hospital, but you are sometimes in somewhere, and yes, then you need this all headsets, big computers and something else. Then we need just PC version for this training. Scenario builder is our part. What is it? Separate program. It's not part of trauma simulator, but it is absolutely standalone program when you can build this scenario, build environment, check scenario, and after that you can save file, send to trauma simulator, and make new this scenario. IMM, this is new thing. With University of Washington, we have making cooperation together in University of Washington, making this IMM, Advanced Modular Mannequin, with some mannequin. You can training on it, make some surgery treatments or something else, but this mannequin is a little bit complicated than standalone mannequin in some universities. It is with some servo motors, some breathing system, heart system, blood system, and everything almost is working. And we communicate with this doll with trauma simulator. Yes, you can make some treatments in trauma simulator, then put this, then send this patient status to this IMM model, make some treatment on this model, and after that you can just return and you see this patient. It is make this treatment in trauma simulator too. Yes, but what our next goals is, first it is different genders, ages, including children, because very many hospitals needs children these treatments, training for these treatments. And of course we need extend our scenario builder, and as I said, this cloud system for multiplayer, it is very big plan, and for this we have Deloitte company in USA what is helping with that, of course with money. And yes, next big thing, it is HoloLens, augmented reality, of course extend UX solution and other things. Okay, thank you. That is all.
Oh, don't go away. So, does anyone have any questions for the speaker? Okay, yes.
Yeah.
Gamification group. That's pretty interesting. I'm kind of curious what you need, for example, to increase the resolution of using the tools or making it maybe more realistic and immersive for operators. Let's see, if do you need, for example, specific kind of suites or those kind of things. For example, there are Tesla suites that gives those haptic feedback and full body tracking. Do you think these would improve this application, and do you need that kind of things?
Yes, of course. As the first step, it is this AMM mannequin, but is a little bit different from what you say, but it's something like first step for that. But yes, we're thinking about, for example, special gloves, special something else. Yeah, when you, because any these treatments have very difficulty. Yes, for example, you need just cut in right position. It's not just put this, and this is very hard. But yes, we're thinking about it.
Thank you very much.
Right. Next question.
So I work in card games, so that's very much different. But I've been working a lot with VR recently. We realized there was a problem with the feeling of doing things, that you didn't get feedback when you put cards on the table and you didn't hit the table with your hand, and that felt really off, and it kind of removed experienced card gamers from understanding what's going on. How do you treat this in such a training simulator like this? Like how do you provide that experience? I heard you talked about feeling recognition gloves, but are there more things to do that with?
At this moment, not more things, because yes, it is very hard to this, especially when you need some press some I don't know, wall, or for example this patient. For now, we have not we have, but in world it is experiments with that mechanics, but for now it's very at the beginning stage, and for now we don't have solution for that.
Yeah, go ahead.
I have more. So we also encountered another problem, which was the reach of the players. When the players are at the table or at the desk or at the space, it's really hard to reach everywhere, and the only way to move around is teleportation most often, because the UX doesn't work if you allow players to walk around freely that well. So what we encountered the problem of getting people to reach everywhere was a problem. Do you encounter the same thing in trauma simulator?
Maybe I don't understand to the end, but yeah, maybe.
So when the players are operating, for example, there might come that they need to micro adjust their position, like shuffle a step to the left. How did you solve that issue, since you did mention you have teleportation?
Yes. If we have only one this player, it's not a problem. Yes, because it is very precise, this headsets, and it's very precise position in your room. This is problem when you have in multiplayer. Yes, then there is very difficulty. And first of all, in some multiplayers, for example, we have this multiplayer when you have just teleportation or sliding, everything, and everywhere going around, just crossing each other. But when we're making this 5G experiment in Adage Polygon, we have a little bit bigger space than this room, and you just going around. You don't use any sleep method or teleportation method, and then it is very precise.
Right, any more questions?
So I'm sorry for stealing the mic. If anyone else has a question, probably take them. But so since we're working in multiplayer as well, we encountered an issue where players got an extreme uncanny feeling when they interacted with each other. If they like touched each other's hands or like interacted with each other, that turned into a huge uncanny problem. Did you try to solve this in some way, and how did you do that?
No, because when you have, as I said, this experiment, when you are in this room, you make collision in real life, and then don't need this. But if you are, for example, in different rooms, for example, I am sitting here, but someone's sitting in university, then of course we just going through and not making collision. It is first of our UX decision, decision about this technicals and NURS, where we need this collision too. If there stand some technical, if we going to close, we need to collision. But we make a choice, don't make collision. We just going through, because it is a little bit weird when you have this something on your way.
Right, any more questions? I actually wanted to ask you a question. So you mentioned the patients, and obviously when you look at the patient and you see his leg is missing, that is pretty obvious where the problem might be, or when he's bleeding. And you also have the monitor that says this is his heart rate, this is his blood pressure, but not everything can be seen in the monitor or so obvious visually. So do you have anything in addition?
Little bit, because in real life this trauma treatment, it is very stressful and it is very short. It is about 5 or 10 minutes maximum when you need understand this patient needs to going to home or needs to going some more treatments. And only things it is some palpations, you press, for example, on stomach. If patient reaction with the pain, our patient reaction with the pain, then it's something with this so much and need looking else. Of course, we have this blood analysis. We have many this vital signs. What we are looking. This doctor can looking at it and start understanding about what happened with this patient. But yes, mainly it is this palpation procedure. Of course, open mouth for this airway obstructions or listening breath rate with stethoscope. For example, if you have pneumonia or something else, then you can listen in this sound. Our sound, it's different for injured patient and not injured.
Okay, so that will be it. Thank you so much, and here is your gift.
Thank you.
For this.